Is your child depressed or just irritable and difficult? It's a good question. We all know adolescents can be moody, but sometimes it's more than just teenage angst. The question is, when does their behavior point towards a larger problem? Depression is a very real and serious condition. If it's not treated, depression can be seriously debilitating. Hello, I'm Dr. Les Linet. I'm a psychiatrist, board certified both in adult psychiatry and in child and adolescent psychiatry, and I hope to help you understand psychiatric problems. I am participating in Speak Up for Kids, a nationwide education campaign for national children's mental health awareness, sponsored by the American Academy of Child and Adolescent Psychiatry, Child Mind Institute, Hunter Boot, and Parents Magazine. Millions of children in America have psychiatric disorders, and at least half will never receive help. Misunderstanding and stigma prevent parents from seeking help for many children who are suffering. I hope to help inform people that mental illnesses are real, common, and treatable. Normal development. All teens can be moody and rebellious at times. Their bodies and their minds are going through major changes, and they are learning to cope with new, stressful teenage situations, like the breakup of a romance, not making the team, getting a bad grade. This can often cause a teen to feel depressed or become irritable, but it is not necessarily a depressive illness. But child and adolescent depression is a real disorder. It's not rare. A large proportion of adults with major depression had their first episode during childhood or adolescence. It's important also to recognize that major depression doesn't look quite the same in youngsters as it does in adults. Please don't view adolescent depression as trivial. It's associated with social impairment and academic impairment. Sometimes, but not always, with psychotic symptoms. Sometimes, but not always, with suicide. Suicide, in fact, is the third highest cause of death in adolescence. It also has an increased risk for depression, again, later in life, in adulthood. Each year, as many as 8% of the adolescent population will begin exhibiting signs of depression. The following are the signs and symptoms of major depression, and they apply both to youngsters and to adults. It is important to determine how long the mood symptoms have been present. They are warning signs if they have appeared for at least 2 weeks, nearly every day, and for most of the day. However, there are differences between adults and youngsters. Youngsters are more reactive to the environment. They may look happy and feel happy in environments in which particularly friends are present, social environments. This tends not to be so much an issue with adults who may continue to be depressed in different environments. Also, youngsters may look happy, may not look sad, but can be quite depressed and hopeless, whereas adults often with major depression look sad. You can see it on their face. I'm not going to go through all of the signs and symptoms on the slide. I will mention that the first one, sadness, irritability, and acting out, for youngsters, sadness may not be so evident. Instead, irritability, acting out, miserable behavior may be more obvious. It's important to know the differences in how adults and adolescents manifest and experience depression. The first item, depressed mood or loss of interest in pleasure in nearly all activities, is characteristic of adults with major depression. Adolescents may not seem so depressed, and I have made that point. Second item involves appetite. There is in adults often a decrease in appetite, whereas adolescents may overeat during depression. There's another feature that I want to mention, and that is that adults lose their appetite for the hunt and the feast. I'm going to explain what I mean. In adolescence, they just lose the appetite for the hunt. Now, the explanation I'm going to give will be by illustration of an example. A depressed teen, for example, may not want to go out for pizza, so to speak, not to hunt for pizza, but once the pizza is sitting on the table, he or she may be able to enjoy it. Next on the list is sleep. Adults with major depression often have a decrease in sleep, while adolescents have an increase. Regarding sexuality, adults often experience a decrease in libido, while adolescents often manifest little change. The social environment plays a role. Adults often will continue to experience major depression in different social environments, while youngsters may be able to react in social environments with friends with an improved mood, only to return home depressed, moody, irritable, difficult. Treatment. The good news is that research shows that there is a window of opportunity of 2 to 4 years between first noticing the symptoms and the development of the full-blown disorder. And during that 2 to 4 year period, treatment is most effective at reducing the depression. When it comes to depression, as many as 80% of teens suffering from depression can be successfully treated if they seek help from a doctor or therapist. Now, there are two classes on the slide of treatment. One is psychotherapy or talking treatment. The other is psychopharmacology or medication treatment. The FDA has decided, based on research, that all antidepressants run the risk of encouraging suicidal thoughts, and they all carry warning labels to that effect. But the phenomenon is both rare and has been tied only to suicidal ideas, not actual suicide attempts. So therefore, experts believe that the benefits of these medications for depression far outweigh the risks. This is a treatment study called TADS, Treatment of Adolescent Depression Study. I'm going to make this simple. There were 3 groups studied. One was treated with medication, one with therapy called CBT, cognitive behavior therapy. The medication group was called SSRI. That's a class of antidepressant medication. All 3 treatment groups did have a response to treatment. Medication worked better than CBT, cognitive behavior therapy, but the most effective response was with the combination of medication and CBT. So the conclusion is that combined treatment is superior to either medication alone or CBT alone. And in the next slide, the conclusion. Depression is very real and should not automatically be written off as adolescence. Number 2, depressed mood may not show on adolescent faces. Number 3, the mood is often irritable rather than sad. And number 4, 80% respond to treatment. Thanks for listening.